Hello, my friends. Welcome back to my channel about health, diabetes, and hormones. Today, I want to talk about a subject that concerns millions of men worldwide: low testosterone and fatty liver disease, which doctors now call MASLD, metabolic dysfunction associated steatotic liver disease. Maybe you've been told you have a fatty liver during an ultrasound. Maybe your doctor said your blood sugar is high, your cholesterol is high, and your testosterone is low. And you thought, that's just aging. But the truth is, all these things are connected. And today, I will explain how testosterone therapy might actually improve your liver, your metabolism, and even your life. And I will share with you the results of a brand new scientific study published in January 2025 in Clinical and Translational Gastroenterology. Stay with me, because this video might change how you see your health. Let's start simple. Your liver is like the chemical factory of your body. It cleans your blood, processes food, and stores energy. But when too much sugar and fat are circulating in your body, your liver starts to store fat inside its cells. That is what we call fatty liver. Today, more than 30% of adults worldwide have it. For many, it's silent. No pain, no clear symptoms. But inside, the liver is struggling. If it progresses, fatty liver can lead to inflammation, scarring, fibrosis, cirrhosis, and even liver cancer. And here's the important link. Fatty liver almost always comes together with insulin resistance, obesity, type 2 diabetes, and low testosterone in men. Testosterone is not only about sex drive or muscle mass, it is a key hormone for metabolism. When men have low testosterone, they gain belly fat, their blood sugar rises, their cholesterol and triglycerides increase, their muscles shrink, and yes, their risk of fatty liver goes up dramatically. So, researchers asked a big question. If we give testosterone back to men who are deficient, can we heal the liver? In January 2025, scientists published a systematic review and meta-analysis. That means they looked at all the best studies available on testosterone therapy in men with fatty liver. They analyzed 9 different studies, hundreds of men with low testosterone and MASLD, follow-up ranging from 12 weeks to 8 years, different methods of measurement, MRI, CT scans, blood tests, and even liver biopsies. And here is the big result. In almost every study, testosterone replacement therapy, TRT, improved the liver. Let me break it down. Fat in the liver decreased. Scans showed less fat inside liver cells. Fibrosis regressed. In the LIFT study, some men's liver scarring actually reversed. Liver enzymes improved. Blood tests, ALT, AST, went down. Some men no longer met the criteria for fatty liver. In other words, they no longer had the disease. Isn't that powerful? So what does this mean for a man like you or me? Imagine your doctor tells you your testosterone is low, your liver is fatty, you have prediabetes or diabetes. This is not 3 separate problems, this is one big metabolic problem. And TRT may help address it at the root. But let's be clear, testosterone therapy is not magic. You still need proper diet, exercise, sleep, and medical monitoring. But TRT may give your body the push it needs to heal. Think of it like fixing the master switch of metabolism. Of course, the big question is it safe? In this meta-analysis, the researchers carefully looked at side effects. The good news, TRT did not increase the risk of heart attack, stroke, or prostate cancer compared to control groups. But there are some things to watch. TRT can raise hematocrit, make the blood thicker, so your doctor must check it. It can slightly raise blood pressure in some men. You must monitor your PSA and prostate health. Overall, the safety profile was reassuring. Even the FDA recently removed the old black box warning about heart disease from testosterone products. Now, let's be honest, not every study was perfect. Some had small sample sizes, some used gels, others used injections, doses and methods varied. Follow-up times were very different, 3 months versus 8 years. So while the results are very promising, we still need large international randomized trials to confirm everything. But for now, the direction is clear. TRT improves fatty liver in men with low testosterone. If you are a man with low testosterone and fatty liver, here are the key lessons. Get tested. Know your testosterone level, fasting glucose, and liver enzymes. If low testosterone is confirmed, talk to your doctor. Don't buy unregulated supplements online. If you start TRT, monitor carefully. Blood work every 3 to 6 months. Combine therapy with lifestyle. Diet, exercise, and weight loss still matter. Remember the long game. Fatty liver develops over years. It also heals over time. So my friends, here is the bottom line. Testosterone therapy is not only about restoring energy or improving libido. For many men, it may actually heal the liver, reduce fat inside it, and even reverse scarring. This is not science fiction. This is real. Published data from 2025. If you or someone you love has diabetes, obesity, or fatty liver, ask your doctor to check testosterone. It might be the missing piece of the puzzle. Stay healthy, subscribe to my channel, and in the next video I will share more about testosterone, metabolism, and how we can fight diabetes together. Thank you for watching.